How do you treat epilepsy? There are two basic arms of treating epilepsy. One is the medicine therapy or the drug therapy, and then the non-drug therapy or the natural therapies. So there are various types of anti-seizure medications, and anti-seizure medications have been developed over 50 years. Now we have got the newer generation drugs, the first generation, the second generation, and then the third generation drugs. Now the choice of drugs depends on the type of epilepsy and the other comorbidities that a person has. For example, if somebody has lack of sleep, then you choose a medicine which can induce some sleep. If somebody has migraine, you choose a medicine like topiramate or sodium valproate, which can help in controlling the migraine also. If somebody has depression or mood disorders, again you choose medicines like carbamazepine, oxcarbazepine or valproate, which can help to control the other psychiatric comorbidities. And if there is a student, you need to avoid drugs which can cause sedation. Some medicines cause reversible cognitive dulling. You need to avoid those kind of medicines in students. So the medicine is tailored to a given subject. So although there are 20 types of medications, every medicine cannot be used for every person. For example, if somebody is obese, you use a medicine like sodium valproate, it makes the person fatter. So basically the treatment of epilepsy is with choosing an appropriate anti-epileptic medicine for a given epilepsy syndrome. So you need to classify the epilepsy as a focal epilepsy or a generalized epilepsy. In some instances, you can't classify it as a focal or epilepsy. Then you choose a medicine which is a broad spectrum drug which works for different types of medicines. One important point to understand is that the anti-seizure medicines don't cure epilepsy. It's only to prevent seizures from happening. It's a prophylactic therapy. It works on the electrical changes which lead to seizures. So we have patients who say that we have taken medicines for 3 years, 5 years, and still seizures happen. So the anti-seizure medicine is not meant for curing anything, it's just to prevent seizures. What can cure epilepsy is the natural process in the brain, the healing process which happens. Now, many of the epilepsies are hormone dependent and are age dependent also. For example, the benign childhood epilepsies, they start between 3 to 8 years of age, and by time child is 12 or 13, they go off. Many of the childhood absence epilepsies also go off as the child grows up. Whereas the juvenile myoclonic epilepsies, many of the idiopathic generalized epilepsies, they start in the second decade, around the time of puberty, and are often hormone dependent. Some people develop seizures only during periods known as catamenial epilepsy. So there's a close relation between your age, your physiology, the hormones, and occurrence of seizures. The treatment is generally long-term, and depending on the underlying cause of epilepsy and the syndrome that we can identify, the duration of treatment can be planned and the choice of medicines can be made appropriately. Apart from medications, non-drug therapies are very, very important, and this include the lifestyle measures, proper sleep for 8 hours, food on time, a low carbohydrate diet, regular yoga and meditation, avoiding undue exhaustion, over-exertion, undue mental stress, and of course taking the medicines regularly. So these are all some of those non-drug therapies, the lifestyle measures which help to control the seizures to a great extent.